Today, we are going to talk about joint pain and the underlying cause of this joint pain that you feel and other related muscle pain and stiffness and tightness and your ankles cracking when you get out of bed in the morning, and whether it be knee pain or hip pain, back pain, shoulder pain, maybe when you swing the golf club, so many different forms of pain. But all of these pains have an underlying cause, one underlying cause. Hi, I'm Robbie Stahl, Harvard educator and inventor of the biomechanical optimization system. And that one underlying cause is misalignment. So many people think, well, should I do more movement or less movement? Well, you know, as you're getting older, if you begin to do less movement, you will be able to do less movement. If you do more movement, you'll be able to do more movement. But more movement oftentimes hurts because of all these things we just talked about. So what do? What's the answer? And that answer is, as long as the movement you're doing is directed towards realignment or putting your joints in the right position and structuring your muscles with the length and strength to be able to function in an ideal way, it's going to remove pain and make you super fit and even feel much younger, all simultaneously. So in this video today, I'm going to show you simple, easy to apply stretches and strengthening that will immediately make huge results for you and your body. And today we're going to focus on back and hips. If you apply these methods I'm about to show you, you may start getting results about as fast as you just saw me grow my beard. Now, when it comes to your back and hip health and having really well functioning back and hips free of pain, it has a lot to do with several things. But the things we're going to focus on, which are really the most important, are your ability to do something called flexion and extension of your hip, internal and external rotation of your hip, and also to really use your glutes properly. What is flexion and extension of the hip? This is flexion of the hip, and this is extension of the hip. Your ability to do flexion of the hip and extension of the hip saves your back from having to do that motion. Because if your hip is limited in that range of motion, then when you go to bend over, for example, go ahead and bend over and touch your toes and let your back really round. So if her hamstrings were tight, then she would round her spine much more every time throughout the day. Go ahead and stand back up during or not even during exercise. And of course, extension, every time she brings that femur back, it's going to cause her spine to go into an excessively curved position. So bring this back and place your foot on the ground. So if her extension was limited, then every time it would cause her lower back to excessively arch. And this, of course, causes impingement in the spine and degeneration of those joints. So by having proper hip motion, you can greatly save your spine from having to do those motions that really the hip was intended for. How do you know whether you have good range of motion in hip flexion and in extension? Well, you can do these tests at home or in the gym on yourself. So first, to test hip flexion, which you remember is the leg coming up and as far back as you can. So in this position, as you can see, Wanda's a little short of 90 degrees. So her spine's about like this and her hip was about here, which is less than 90 degrees. And really, to have good hip flexion, range of motion, you want to have at least 90 degrees. Wanda's right leg didn't have 90 degrees. Let's see how her left leg does. So keep your knee really straight. So it's very important that you keep your knee very straight. Of course, if you bend your knee, and you can go way back here, well, that's a false positive. I think you're doing better on the test than you are. So keep the knee nice and straight, and go ahead and drop this leg. So you'd want to see that both legs can go to 90, and you're also looking at, is one leg different than the other? So for example, if Wanda's right leg only came to here, but then Wanda's left leg could come way back here, then she would want to do more mobility training on her right side to become symmetrical because being symmetrical from one side of your body to the other is really the most important thing. Even more important than her being able to do more total range in both legs is more important to be symmetrical, to get those sides even. Now, to look at hip extension, you'd want to draw the knees into the chest, bear hug your legs, and then let one leg go. So Wanda's bear hugging this knee into her chest, pulling nice and tight. And she's completely relaxing. Relax completely. Relax completely. Yep. Good. Are you totally relaxed?
I think so.
Okay, so in this case, Wanda's leg's not lifting, but her knee is extending, which would mean that her rectus femoris, she has a tight rectus femoris, which comes down and attaches into the lower leg. So her hip flexor is not tight, but one muscle is. So she would stretch her rectus femoris. So she would do stretches that put her into a hip extended position, and she would hold that position. And specifically for the rectus femoris, where the knee is kind of straightened even when you're relaxed, you'd want to put this knee at a bent position back behind you, or even elevated behind you, and that will stretch the rectus femoris. So if you have tightness in the hip extension position, you know what to do. If you have tightness in hip flexion, for example, like Wanda's right side, then you would want to do stretching of the hip flexion position. The way to add mobility to your hip flexion position and mobilize those hamstrings, one really good way is to get a band or a rope or a towel, something that you can put around your foot and bring your knee into that straight extended position, and then draw backwards like this using the opposing hand to hold, and just hold the position for 30 seconds to 1 minute, and then do multiples on each side, so at least 2 times. Next, what is internal and external rotation of the hip? And how do you test this on yourself? We can lay on your back, on a table, on your bed. Bring your knee over the top of your hip. From an aerial view, keep the knee directly above your hip. Go ahead and rotate your lower leg inside. This is external rotation. Is the femur, the thigh bone, is facing outside. And internal rotation is facing that femur towards the inside. So external rotation and internal rotation. You want to have at least about 40 degrees of external rotation, which is about right there. Then you want to have at least 30 degrees or near 30 degrees of internal rotation, which is right about there. So in Wanda's case, she meets the adequate level of both. And usually where a person has a problem or is causing back pain is when one of those range of motion, total of 4, right? External and internal rotation. There's 2 on one side, 2 on the other. Usually one is restricted. So example is internal rotation. With the femur going inside, that's really common for people to have lower back pain and a limited internal rotation on one side. If you find that you have limited range of motion in external rotation or internal rotation, here's what you should do. If it's limited in external rotation, so you really feel like you have a limitation when the thigh is pointing outside, then this is the stretch that would help you. So put your leg across the other thigh in a figure 4 position, raise the other leg, and if you're pretty mobile, you can grab over the top of the thigh. So go ahead and bring this one on top. So you want to use this arm over the top of the shin so that it helps keep this shin and ankle down against the other leg. Otherwise it can slip off easily and you start compensating the position. If that's really hard for you to get into, then you could cheat and use a towel and go around so that your actual hands don't have to reach all the way behind your thigh. That's the way to mobilize, one really good way to mobilize external rotation. To mobilize internal rotation, and remember, internal rotation is when your femur, thigh, is rotating to the inside and the lower leg is rotating out. So to mobilize that position, if you're tight, which you can see I have some restriction there, so you can put your foot on the outside and then rotate that knee to the inside. Now what you want to look for is that this side hip that you're stretching, you don't want it to lift. You want it to stay flat on the ground the best you possibly can. Then rotate this knee down, and you can even add some manual therapy to this by taking your thumb and digging in all the glute muscles. It's because these are the muscles that externally rotate the thigh, that are tight and very, very commonly cause lower back pain. So keep trying to pull the knee to the inside and just dig through the whole glute muscle in this area, in this region here, with your thumb. When it comes to using your glutes properly, there's a couple things that are really important. One of those things is when you're doing step-ups or lunges or squats. For example, in a step-up, good, go ahead and come back down. You want to keep your femur in line. So from your hip joint to the knee joint, you want to keep it in as much of a straight line as you possibly can. What you don't want is the patella to fall past the midline there. That's really bad. That's really hard on your knee, it's really hard on your hip, and it's hard on your back. So just keeping this femur in line. Go ahead and practice that, Wanda. Go ahead and make that right foot straight. Yes, go ahead. Keep it in line. Good. Awesome. So that's one really important thing, and that really helps train the glute medius properly. So the middle glute, the glute that's mid-size and middle and helps keep the hip up, that really helps that muscle. So face this way. Let's show the back of you. The next most important thing is you want to make sure that your pelvis stays as level as you possibly can during squats, of course, but also especially during lunges and step-ups. Most people, even fit people and trainers, get this one wrong. Very important to keep your pelvis as level as you possibly can. So let's go ahead and step up. Notice Wanda's pelvis stays pretty level. Let's do one wrong. So go ahead. Yep. So a lot of people do this. They kind of let this hip, their support side, kind of come out to the side, and they let this contralateral side go ahead, drop down like that. So you want to keep it very level. You almost want to be trying to pull this side down excessively and pull this one up when you do step-ups and lunges. The things you just learned in the step-up can also be applied for proper movement in things like lunges or any other position that you're taking like this. So in the step-up, you saw Wanda keep her hip in line with her knee. In the lunge, it's very important also to keep that proper alignment as you're going through your lunges. Keep the proper alignment. You do not want to be doing lunges like this, which over 50% of people I see do lunges do like this. Even trainers let their clients do lunges like this, which is dangerous and leads to very poor results. And not necessarily will get hurt from this the same day you do it, but it can lead to injury outside of the gym, and it can also lead to excessive degenerative joint disease. Second thing that you learned with the step up that also applies to the lunge is keeping the pelvis in line. So right side pelvis in line with left side pelvis and not veering off to the side like that. That's poor mechanics for the hip. It lets the glute medius be weak, and it puts excessive stress on the spine. Then, with the lunge, it's also very important that you stand all the way up. I see people and trainers all the time put all this load on their back and carry heavy dumbbells and then do lunges like this. Stop here and then go into the next step and stop here. No, you'd be better off lightening the load and standing all the way up. Really contracting that glute and coming into an upright position. That's the way you properly utilize your glutes. I hope you found a ton of value in that education that I just provided you on how to realign your body while getting super fit. If you have any questions on that, feel free to contact me. I'd love to answer your questions and help you out further. In the coming weeks, we're going to be giving you the same type of content for the other areas of the body that are most common to have joint pain and other related muscle pains and aches and stiffness. Those areas are feet and ankles, knees, shoulders, and neck. Remember, it's up to you to make it a great day and a healthy day.